In today's video, we will be discussing about neurovascular assessment. Before entering into this session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. The learning objectives we will be discussing in this video will be: what is neurovascular assessment, why neurovascular assessment is important, what are the key components of neurovascular assessment, and what are the additional assessments. Let's get into the session. A neurovascular assessment is a critical nursing practice used to evaluate the sensory and motor function of a patient's limbs as well as circulatory status. This type of assessment is particularly important for patients with conditions that affect the extremities such as fractures, casts, orthopedic surgeries, or vascular injuries. Now, why is neurovascular assessment important? Early detection. To detect issues like compartment syndrome, nerve compression, or poor circulation before they cause serious harm such as nerve damage or tissue death, neurovascular assessment is very important. Another reason why neurovascular assessment is important is monitoring nerves and blood flow. This ensures the limb gets proper blood flow and nerve function, allowing for prompt treatment if something is off. And the other reason could be better patient outcomes. Regular checks can prevent long-term issues, shorten hospital stays, and lead to a smoother recovery. Next, the neurovascular assessment is often remembered by the 6 P's mnemonic, and they are pain, pallor, pulse, paresthesia, paralysis, and poikilothermia. Let's discuss them one by one. First is pain. Pain assessment includes asking the patient if he or she feels pain in the affected limb and note where it hurts, how intense it is, and what kind of pain it is, for example, sharp, dull, etc. Next is using pain scale for this assessment. Pain that is unusually strong or doesn't go away with medication might mean there is a problem with blood flow. What are the actions taken for pain? If the pain is severe, especially when moving the limb, it could signal compartment syndrome, which needs immediate medical attention. Next comes pallor. Pallor assessment includes checking the skin color below the injury and compare it with the other limb. Normally, the skin color should match the rest of the body, showing good blood flow. If it is abnormal, it might be indicated by pale skin, that means poor blood supply, or a bluish color might indicate blood pooling. Next comes pulse. Assessment includes palpating the pulse distal to the injury or surgery site. Example, radial pulse, dorsalis pedis, posterior tibial. Check both the presence and strength of the pulse. Normal finding will be a strong, palpable pulse that indicates adequate blood flow. Abnormal findings include a weak or absent pulse that might suggest impaired circulation, necessitating urgent intervention. Next P is paresthesia. Here, ask if the patient feels numbness, tingling, or pins and needles in the area. Normally, the patient should feel normal sensations in the limbs. If it is abnormal, there might be numbness or tingling, which could mean nerve or blood flow problems. If it gets worse, seek medical help immediately. Next P is paralysis. Assessment of paralysis include evaluating the patient's ability to move the affected limb or digits. Ask them to wiggle their fingers or toes or perform a grip test if applicable. In normal findings, the patient should be able to move the affected limb without any difficulty. Abnormal findings might include inability to move the limb, or muscle weakness may suggest nerve damage or severe compartment syndrome. The last P is poikilothermia. Here, assessment includes using the back of your hand to compare the temperature of the affected limb with the other limb. In normal findings, the limb's temperature should be the same as the rest of the body. Abnormal findings might include a cooler limb that might suggest poor circulation, while a warmer limb could indicate inflammation or infection. Now comes additional assessment considerations. First thing is capillary refill time. Press on the nail bed or the pad of a finger or toe distal to the injury, then release. Observe how quickly color returns. In normal finding, the color should return within 2 seconds. If it is abnormal, there is delayed capillary refill time that is more than 2 seconds, and this might indicate compromised circulation. Next consideration is edema. Assess for swelling in the affected area. In normal findings, no significant swelling should be present. In abnormal finding, swelling can indicate inflammation, venous stasis, or increased pressure within the compartment. Next consideration would be observation of the skin and surrounding tissues, where we check for any signs of bruising, wounds, or abnormal skin conditions that might indicate underlying complications. So far we have discussed what is neurovascular assessment, why neurovascular assessment is important, what are the key components of neurovascular assessment, and what are the additional assessment considerations. So here you go with neurovascular assessment. If you find this video useful, please like it, share it, and subscribe it, and do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.